even if you're feeling well, you should have a face covering that adequately covers your nose and mouth. That keeps potential viral particles to you and protects everybody. So if we all do it, we protect each other. And a well-made mask that fits well on your face with very few gaps can actually protect the wearer from potential droplets and aerosols that can transmit the virus. I understand people's concern about risks related to public transit. I think the risks are mostly related to the potential for crowding and for close prolonged contact with other riders for long periods of time, and by that I mean more than 15 minutes. So I understand TriMet has taken steps to space passengers out, to increase cleaning, and we're really pushing messages not to use public transit if you're ill. If you are going to use public transit, use a face covering and really respect what TriMet has put in place around spacing out passengers. So I think everyone is going to have to make individual choices about how they move about in counties that are reopened and potentially if Multnomah County opens. I think it's certainly reasonable, especially if you're coming home to someone who is high risk, to carefully take off your clothes, put them straight in the laundry. I would say the most important thing after getting to your destination is washing your hands. Everyone is going to take actions based on their personal risk and personal preferences. There's certainly nothing wrong with disinfecting a space before using it. I would say the most important part, though, is disinfecting or washing your hands with soap and water afterwards. Everyone now knows the 6-foot rule, I think, as far as being the safe distance that we consider to lower risk of transmission. If you can't reliably maintain 6 feet of distance indoors or outdoors, you want to be wearing a face covering if at all possible. So I would say our unhoused neighbors are not disproportionately affected by COVID-19, and Multnomah County strongly condemns any kind of discriminatory behavior. We do know that the virus affects different people differently, but my advice to TriMet users is to assume that anyone could have the virus and take the right precautions to keep yourself safe. In general, public health has a strong recommendation for everyone to wear face coverings, especially on public transit. Keep in mind that not everyone can use a face covering for different reasons, so please don't assume. Keep yourself safe by wearing a face covering, maintaining the 6-foot distance, and using really good hand hygiene, especially after disembarking. What we know is that it takes close face-to-face, pretty prolonged contact for the virus to spread. There have been studies that show that the virus can live on surfaces, so avoiding contact with surfaces, and most importantly, is washing your hands after contact with public surfaces. I don't think we can quantify that risk. In general, as people go through their day and touch surfaces, the most important thing is good frequent hand hygiene, soap and water or hand sanitizer, trying not to touch your face, and again, using a face covering as much as possible. So in general, as places reopen, as people mix more and go about their lives, we expect to see the virus spread because we know it spreads easily from person to person. At this point, which is mid-June, we're seeing quite a bit of spread among close contacts, including in close social networks. So I would urge people to use precautions on public transit, but don't forget that loved ones and people that you know well may also be a source of the virus. Everyone has to decide the level of risk that they can accept individually and for their households. I think TriMet has worked hard to make transit as safe as possible, knowing that people rely on it to do essential jobs. As far as waiting for a vaccine, our hope is that one will be available as soon as possible. We don't have a date, and again, that's going to be an individual decision based on what's happening in our community with the virus and based on individuals' needs related to public transit.